I've had multiple, types of injections. I've done the stem cells, I've done the PRP, and now the A2M. And the biggest difference I found is the stem cells work great, but there's a huge downtime. I remember it was 6 weeks off, and then it was 6 weeks of kind of easy control, and I don't have 3 months to recover in my season, but they definitely worked really well. The PRP didn't work as well as the stem cells. The downtime was a little bit less, but it was definitely real painful for a few days. The PRP itself and my shoulders hurt the most. And then the A2M is kind of in between, where the pain is a little bit less than the PRP, but I can actually perform and train the next day if I need to, or even race that weekend. So for me, that combination of having something that works really well, gets me back on the water right away, and that's huge for an athlete who's trying to perform. And everyone thinks it's the performances in the races or the games, but realistically, if we can't train, then we're not going to be ready for any of those. And having A2M allows me to get right back in the water, right back in the gym, and virtually no downtime, and almost all of the results from the stem cells. And I would probably equate most of the stem cell progress to taking 12 weeks off, which is also a nice thing for an athlete to have some rest. But being able to train, I think, is really key, and A2M allows me to do that the next day. Been coming here for years, and if you want to be treated by the best people that, Dr. Tierney himself actually does do a lot of athletic endeavors. He stand up paddleboard, he serves, he used to be a weightlifter. Dr. Goines, Dr. Tierney, these are the best. They work great together, and I've been coming here for years. I've had great success.